Hi, I'm Alan Silverman. I'm a pediatric psychologist. I work for the Medical College of Wisconsin. And I've been working with children with feeding disorders and their families for quite some time. I'm here to talk to you a little bit about some of the different treatment philosophies and the different players who might be involved in working with you and your family as you try and grapple with feeding problems. The first thing that I want you to know is that feeding problems aren't your fault. They're very common. In fact, it's been estimated that upwards of about 30 to 40% of typically developing kids can have feeding problems. And that might range anywhere from just picky eating to having really limited intake and things that can negatively affect your child's growth and development. So these are very serious problems, but also very treatable. One of the hard problems that families encounter, though, is knowing how to navigate the system of different providers and different therapy approaches. So that's what I want to talk to you a little bit about. When we think about feeding problems, there's probably 3 or 4 different types of providers that you're going to come in contact with. And the first should really be a pediatrician who's well trained in feeding disorders. The most common types of pediatricians that you're going to find are going to have subspecializations that may include gastroenterology for children who have problems with digestion or problems with the anatomical structures involved in digestion. You may also come in contact with developmental pediatricians who specialize in some of the problems that development can play in helping a child get appropriate nutrition. The third type of provider that you might find from medicine is rehab doctors. And these are the doctors who work with children who require a lot of help to overcome chronic conditions that may not be able to be resolved through medical intervention alone. When you're seeking out help from a medical provider, it may be helpful to really have a good comprehensive discussion with your pediatrician first to get some insight as to which specialist might be most helpful for you and your child. After that, it's probably useful to have a comprehensive medical workup so that you understand what the medical factors are that are affecting your child. Along with that, you'll probably meet a number of other providers. But again, every child's feeding problem is somewhat different. And so you need to have close cooperation and a working relationship with your provider to know where to go from that point. Because every feeding problem can be different, it's usually best when you have a full team of people taking a look. But some of the people that you may be referred to may include occupational therapists who tend to specialize in sensory-based types of interventions and assessment. They also tend to specialize in adaptive technologies that may help a child who has physical limitations to be more independent with their feeding. You may encounter speech and language pathologists. These are providers who will do assessment around your child's chewing and swallowing skills, and they'll look at some of the oral motor or oral sensory types of difficulties that can interfere with feeding. Usually a speech and language pathologist can be found in the community. Occasionally you may find these providers through your school system. School systems have many different ways of thinking about feeding problems, however. Some school systems will allow their providers to work on feeding issues and others will not. If you encounter this difficulty and the school says that it's not academically necessary to help the child's feeding problem, you may want to seek out consultation with a community-based or private clinic to get that level of assessment and support. The next type of provider that you may come across may be a psychologist such as myself or some other type of behavioral specialist. The role of the psychologist or the behavioral specialist is really to get a sense of what are the behaviors involved in feeding that become barriers to reaching your nutrition and growth goals for your child. Typically, a psychologist won't get involved until the medical assessment or perhaps the oral motor assessment is completed because for most children, eating becomes very natural. It tends to be a normal progression, a shared responsibility between their adult caregivers and the child. But if things go off track, this is where a psychologist can come in and help recreate the feeding relationship between parent and child. The hope is that whatever the original problem was that was underlying the feeding problem, the psychologist can help identify it and work collaboratively with either the medical team or your speech and language provider or perhaps your occupational therapist to find the right set of strategies to help your child begin to eat normally again. Really what we're talking about, though, is a comprehensive model of different providers who all look at the problems through a slightly different lens. And because these feeding problems can be so variable, we really need to have all these specialists ideally taking a look at your child to determine what set of interventions might be most helpful. When you go to the community, you may find a number of different treatment approaches. So after you've had your consultation with the medical team, you may be recommended to either start certain medications to enhance appetite. You may be asked to have further evaluation that may include imaging studies to look at the anatomy of the feeding problem. Or perhaps you may be recommended to have certain procedures to help resolve underlying problems from a medical perspective. Typically after this, the medical management may partner up with any of these other disciplines that I've mentioned before. The first place that most people go is to the community, where they may have the involvement of a speech and language pathologist or an occupational therapist. Many of the interventions that they use may include sensory types of interventions. You may find that this is the most common strategy for treatment of feeding problems. The sensory strategies are intended to look at how a child interprets their world through all of their senses, through sight, through smell, through taste, through touch. All of these are important in the feeding experience. And if something is unusual for that child, feeding may become aversive or even difficult. For example, a child who has hypersensation to smell may find odors particularly offensive and may gag or retch when presented with foods that have a strong odor. This may be where a good sensory therapist can come in and give you strategies for introduction of these foods. One problem that we do know about the sensory-based interventions is that they're not well understood at this time, and much more research is actually needed to fully understand how they work and why they work. This being said, it doesn't mean that they won't be effective. On the contrary, many families find great benefit to these types of interventions, but in seclusion, they may not be enough for your child. Alternatively, many people will find help with a speech and language pathologist in the community. Usually the speech and language pathologist will complete an assessment that looks at chewing and swallowing skills along with oral sensation to determine what might be most effective to help a child who perhaps has difficulties with various textures or may have intolerances for certain flavors of things. This individual will usually give you strategies that include exercises that may warm up the mouth. That provider may help you to better understand why your child may be resistant because of sensory or oral motor experiences, or perhaps because of these chewing and swallowing deficits, the child begins to have anxiety about eating. They may be fearful of choking, gagging, vomiting, all unpleasant experiences that children wish to avoid when they're eating. Which brings us to the psychologist. When we have prolonged periods of problem behaviors with eating, we want to be able to address that in a very organized and systematic way. The psychologist typically will take a close look at what's happening with you and your child when you're attempting to feed them. The psychologist should be looking at strategies that will enhance the positive experiences of eating. So frequently they'll engage the parent or other caregivers in finding ways to reinforce the types of behaviors that we want to see as parents and as caregivers. Enjoyment of food, self-feeding, learning how to accept new foods, learning how to chew and swallow without resistance. So from my conversation with you so far, you're probably beginning to get a sense that feeding disorders are very complex and widely variable. There's no one perfect solution for helping your child to overcome this problem. And typically, I think that the best care is usually one that's done through an interdisciplinary model, with all of these providers working together, assessing, discussing, treatment planning, and most importantly, working with you as the parent to come up with a strategy that works the best for you in your home. Because ultimately, it's the parents who are the ones who do most of the therapeutic work. We as the treatment team may give you strategies for figuring out how to do these things. Obviously, you haven't had that training yet, But your team should be able to train you appropriately because the meals day to day are going to be in your home, in your community, in your schools. So ultimately, we become your consultants and we work with you. But as parents, you're the ones that are at the hub of the treatment team. So I encourage you all to have very heart-to-heart conversations with your providers to decide if the treatment makes sense to you, if you feel comfortable with it. If you don't, what are the alternatives? Because ultimately, this is about you and your child finding the right set of providers and the right set of treatments to overcome these difficulties. One common concern that families have is they want to know, how long is this process going to take? Many families are very eager to solve the feeding problem because it has a lot of effects, not only on the child, but on their family. If you think about eating, it's an important component of what we do every day. It's part of our socialization, it's part of our rituals with our families. It's really a very important part of our day-to-day living. So how long should treatment take? There's no common answer to that. Just as all feeding problems are widely varied, so is the amount of treatment that's going to be needed. Perhaps what's most important to think of is that when you begin with your treatment team, that we're beginning a process, and every process takes time. In the beginning of treatment, what you can expect from your providers is that they're going to be completing their assessments, and then they're going to give you some feedback about where they think the problems are coming from. Based on what they think the problems are, they're going to give you some strategies, tools, techniques to help overcome that. But this is the beginning of a process, and many things are involved. Your child has to feel safe and confident with the tasks that they're being asked to do. You as the caregivers have to feel safe and confident with the strategies that we're teaching you. And once this begins, there are going to be changes in direction. Your child's going to mature, the food strategies are going to change, the challenges that you want to present to your child are going to change over time as they begin to advance in their feeding. So rather than asking how long, I think the more important question to ask your providers is, what's the end goal? And then the rest will write itself. You'll begin to collaborate more closely with your team about how you're progressing on your treatment goals, and you'll know when to ask questions if things seem off course. There's no one simple solution to all these feeding problems. Sometimes even the providers get stuck, and we're not sure where to go. In the best case scenario, you're working with a good interdisciplinary team who's going to be able to consult with each other or have a network of other providers who they rely on for other insights. If you're feeling like you're stuck and you're feeling like your provider has tried their very best and things aren't moving forward, don't be afraid to ask more questions or ask for another referral, because ultimately this is about you and your child and advancing their feeding. If there were simple solutions, there wouldn't be so many different players that are involved in it. So it's going to take time. Try and be patient. Work collaboratively with your providers. Ask questions. Establish goals. And if things aren't working, get referrals.
We need your help. We need your financial support. You can visit our website to learn more about our organization. We want you to know more about this. Please tell your friends about it. Please be our champion. We need to spread the word, and we're relying on you.